A very good afternoon. We are coming live from Tendri Embry Children Hospital, and today we are talking about osteoarthritis. My name is Charita Washera. I'm hosting you for the Talk to Your Doctor show, and today we are hosting Marani, who is our orthopedic trauma technicians. And you can find all orthopedic services at Tendri, starting from Majimbo branch, Inner branch, and Doctors Plaza branch. So anytime you have a fractured bone, you can be treated at Tendri Hospital for 24 hours. Today we are not talking about fractured bones, but we talk about osteoarthritis. Out of 100% of people with osteoarthritis, 60% of them happen to be women. So women are at a higher risk of having osteoarthritis. You can share this conversation with your friends, and so that they can ask all the questions they have and they get educated and informed more about osteoarthritis. Karibuni sana to the show and enjoy the show. Karibu sana daktari to the show.
Thank you.
You can talk to the viewers, tell them your names so that they can continue.
Okay, thank you for this time. My name is Marani Frank. I'm a orthopedic and trauma technician.
Yes.
Working with a Tendri group of hospitals at Majimbo. Today we'll be talking about osteoarthritis.
And osteoarthritis, that's a question that we always ask. Why did you choose to do things with orthopedic?
From our previous show on orthopedics, I talked about the increased cases of trauma and bone condition disorders that are affected many people. In fact, in the world, millions of people are suffering from these bone conditions. And today I choose to talk about osteoarthritis, commonly known as ugonjwa wa baridi kwa mifupa.
So ugonjwa wa baridi kwa mifupa. I've heard so many people say nimeambiwa niko na baridi, because that's what people say out there, but we can define what is osteoarthritis.
Well, osteoarthritis, or let me break it down into three categories. Osteo is the bone, arth is the joint, and then itis is the inflammation. So we are talking about the bone joint inflammation. So, in definition, osteoarthritis is the joint disorder that involves degradation or degeneration of the articular cartilage of the bone and the underlying bone. This means at the articular cartilage, at every joint of your body, there is something called articula. Articula is what forms the joints.
Yeah. So actually, that means it happens only in the joints. It can't happen somewhere else. Like only on the joints, the knee joints, the ankle joints, all those joints. So according to research, I was doing some research and I was seeing that 60% of people with osteoarthritis are women. Why?
Yeah, true. One of the causes of arthritis, or women are at high risk of getting osteoarthritis because of the hormonal imbalance. And to be specific, when you look at the anatomical position of the knee joints of many of the women, in medical term we call it genovalgus. The position of the knee tends to deviate to the outside. That means the weight distribution of the body to the lower extremities is not evenly distributed. And as I define osteoarthritis, is the degeneration or degradation of the joint. Yeah. So because of uneven distribution of weight, with time, because osteoarthritis is wear and tear, still the wear and tear of the joint because of age. With time, with age, these women are at high risk of getting this osteoarthritis. Yeah.
So that means arthritis is likely to affect someone on the lower parts of the body more than the upper parts of the body.
Yeah, sure, because of weight distribution.
Weight distribution. Yeah. So it's if people are overweight, they are at a higher risk of getting obesity, of getting arthritis.
Yeah.
Okay, so we go to the during the wear and tear, just like you've explained to us. So which joints or which joint or tissues that are involved in the same?
Okay, to be specific, let me use the knee joint, because the knee joint is a common joint that at high risk of getting osteoarthritis. Yes, of course, there is an ankle joint and the hip joint, but now the knee joint, there is what we call joint capsule. Yeah. This is what we call joint the articular cartilage. There is synovial fluid. There is tendons, ligaments, and muscles. All these are found in the joint, especially in a synovial joint. Synovial joint, when I talk of what I talk about synovial fluid. For the case of synovial fluid, helps in lubricating the joint for easy flexion and other movements. Yeah. So that is another term we call it anatomical structures of a joint. Yeah. Yeah.
It seems osteoarthritis has a lot of medical terms. Maybe you can try to simplify to us so that we are able to understand when you meet maybe the...
Okay, sure. Yeah. So a tendon is a connective tissue that connects a muscle to a bone to initiate the movements. And then there's a ligament. Ligaments, they tend to connect bone to bone. Yeah. Now, for the case of the knee joint, there's an anterior cruciate ligament. There's posterior cruciate ligament. There's also patellar ligaments that attach patella to the bones. There's also other ligaments. There's a lateral collateral ligaments, the medial collateral ligaments that attach the distal femur to the proximal part of the tibia, laterally and medially. Yeah, and then there's also a muscle. In a Swahili term is the nyama, that initiates functions of the knee or of the lower limb. Like when you're asked to flex your lower limb, you flex because of the muscle.
So, because according to your definition, I've already understood one causes of osteoarthritis. That means if you are overweight, obesity, you're likely to have osteoarthritis, maybe on the lower parts of the body. So what are other causes now of osteoarthritis?
Osteoarthritis may come in because of age. And to be specific with age, women are high risk, as I talked earlier, from age 45 and above, and men at age 50 and above. Still, osteoarthritis may come in at an early stage due to injuries occurring around the joint. There is also joint overuse. That happens to sportsmen and women, soldiers, because of the stress that they apply to their joints while running or involving themselves in vigorous activities. There is what we call inflammatory disorders. For the case of rheumatoid arthritis, that when you have rheumatoid arthritis, the high chances that you may get osteoarthritis. There is also metabolic disorder. when you're suffering from diabetic, you are at a high risk of getting osteoarthritis.
Yeah.
There is also I've talked of joint injuries.
Yeah.
Yeah. So apart from age and there's also obesity, as we talked about before.
Yeah.
Those are some of the causes of osteoarthritis.
Okay.
Yeah.
So if someone is able to avoid this, maybe running too much, but I've also seen you tell people to be walking. So that means walking makes the bones to tear.
Okay. Because you talked of age. Walking, or not just walking, but physical therapy helps in reducing. That's part of management in reducing osteoarthritis. Yeah.
Oh, nice. So we go to what after causes of osteoarthritis? This one is too mrefu sana. So how does osteoarthritis present clinically? Like someone has come to the hospital, maybe they have a joint pain, it could be maybe something else, but how do you know that this is now osteoarthritis?
Okay, to be specific, osteoarthritis presents differently from other arthritis.
Yeah.
You know, there are different types of arthritis, but today we are talking about specifically osteoarthritis.
Maybe you can mention them, the types of arthritis, and then now you continue.
Okay, there are different types of osteoarthritis.
Yes.
There is rheumatoid arthritis, there is gout, there is systemic lupus erythematosus,
Yeah.
there is juvenile arthritis, and what else? There is also septic arthritis, just to mention a few.
Yeah. So there are more than 5, because only you've mentioned 5. Then you will hear someone say, I have arthritis, so it could be any of these.
Yeah, but the common is osteoarthritis.
Osteoarthritis.
Yeah.
Now, how does now osteoarthritis present clinically?
Clinically, osteoarthritis presents with pain to the joint.
Yeah.
If not age, it presents with pain, sudden pain to the joint.
Yeah.
Sometimes swelling, the swelling.
On the joints?
Yeah, to the joint. There's a deformity.
Yeah.
There's a crepitus. Crepitus is a sound. When somebody moves, you hear some abnormal sounds from the joints.
Okay.
Those are crepitus. There is also inflammation. There is also a top of joint deformity. Yeah, those are some of the clinical presentation. They are how it presents.
So when a patient comes and presents with those signs, now you say this is osteoarthritis. How are you able to differentiate this is osteo and this is rheuma?
Okay, now for rheumatoid arthritis, it's also an arthritis, but for this case, this is an autoimmune disorder that the system of the body mistakenly attacks its system. And with rheumatoid arthritis still affects the small joints, especially the joints of the fingers, the small joints. But now for osteoarthritis affect the major joints that bear the weight of the body.
Can you tell us all the joints that are affected by osteoarthritis?
There is hip joint, there is knee, there is ankle joint. There are also the back, the spinal.
Yeah.
Yeah.
So those are the joints mostly affected by osteo. So now someone has come with the signs. So what is the clinical examination that someone goes through?
Okay, clinically, we examine the patient by taking the patient history. That is, we start by the onset. How long has this patient stayed with this pain, the stiffness, and the inflammation? We also do physical examination by observing the patient clinically. You're observing by use of your eyes. There is also manipulation by whereby you check any the limitation of the joint movement. There's also what you feel the joint in case of warmth and others.
Yeah. So after you've done that clinically, are there stages? Now the stages of treatments, because we already talked about the types of osteoarthritis, the stages.
Yeah, osteoarthritis has 3 stages that I know. There is stage 1, that is mild. Mild state, that's stage 1. There is also stage 2, that is moderate, and stage 3, that is severe. Yeah.
So after the 3 stages, stage 1, stage 2, are they treatable fully? And there could be the severe stage be like it's not treatable, like you have to stay with it for the rest of your life.
Well, for any disorder or any disease in your body, early detection and early intervention will prevent this disorder from progressing. On stage 1, that is mild, patient normally presents with pain, sudden pain, and mild sudden pain and inflammation. So before we say this stage 1, we normally do what we call X-rays under radiology department to ascertain if there are any features that suspect that this patient has osteoarthritis. For stage 1, radiologically you can't find anything, but the way they present with pain, inflammation, we rate it as stage 1 from the radiology reports. And then there is stage 2, that is moderate. Now with stage 2, there is from the radiology, there is from the X-ray report, you'll find minimal osteophytes. Osteophytes are what we call bone spurs. From the X-ray, you'll notice what we call bone spurs, something sharp objects from the bone that are emerging. So minimally, and still there's inflammation and pain. With stage 3, or now the severe part of it, or let's say chronic, from the X-ray you'll notice there are evidence of osteophytes. Osteophytes are very evident. There's limited range of motion. There's stiffness and severe pain.
So that's how you're able to see it radiologically. So say you said someone is in stage 1, stage 2, stage 3. So how do you treat these stages? Of course, there are different treatments.
Yeah, sure. There are almost 5 managements of osteoarthritis. But before we do the management,